outside the ward. So I decided to check in. Now, when you get to the main gate, you are actually not going to have a chance or an easy way in, and you wouldn't even find the nurses around because they were, I mean, shadowed by the number of patients at the ward. Because the place was full, the beds were all full, the corridors were occupied. I mean, some corridors even leading to some of the washrooms have been used, and there were patients with very severe conditions who are sitting in plastic chairs in a very uncomfortable position. Some are being supported by their relatives. I mean, and you could see that they've been doing this for some hours, and there are some sitting right on the floor.
No, so when you say supported, their relatives are holding them
yes,
upright.
so you could see relatives holding them at the back, at their back, whilst they sit, and you could see they've been doing this for quite some time. So this is the situation that was happening. So whilst observing, I also realized that a colleague had also shared images of what was happening. That was when I supported the information that I was giving out with the images that was there. But I mean, the images even didn't do much justice, like you were there. And thankfully, I had to go back for night duty, so I passed there again, and the situation had not changed.
And I'm looking at these images in a Facebook post that I saw.
Yeah.
Thankfully, the faces of the patients have been covered.
Exactly.
In the pictures.
Yeah.
But I mean, this is a crowded place. In the first place, that's the thing. This is a crowded place. There are a lot of people sitting there. I mean, if this was even a bus stop and you were waiting for a bus in a place like this, you won't feel comfortable.
Exactly.
Because this is a place where so many people are sitting in very close quarters.
Exactly.
I don't know what kind of ventilation is in the place, because you know it's a very old building. The
Exactly.
SME is a very old building. When you are entering the SME, the first room where they have all these papers, what's it called? Does it have a name?
I think that area is for the triaging. That is where
Thank
they
you.
assess the cases when they come
So
in
the
first.
triaging, let's call it a triage
Exactly.
area. There's so many papers and all of that. I think there's a desk or two.
Yes.
And then you enter into, it looks like the hall of a home.
Yes.
Yeah, it looks like the hall of a home. And normally there's supposed to be beds on just the left side, a walkway through,
Exactly.
and 1 or 2 beds on the right side.
Exactly.
What is happening is that there's hardly any room to walk.
Exactly.
If you look at the pictures that I'm seeing here, there's hardly any room to walk.
Exactly.
All you see are, there's this woman sitting outside under a staircase. She's in a green and yellow African print. Her head is bowed. She's receiving an intravenous infusion, an IV, outside. And you can just see it. She's sitting under a staircase. You wonder what kind of wind is blowing, because
I mean, there were some at the car parks right in front of the
there's
ward.
someone lying on the floor. I mean, is this also in the triage area? Look at this for me.
I mean, yes, this is just at the entrance of the triage area.
Just at the entrance.
Yes, so you have to, I mean, use the space available to treat the patient in whichever condition the person is.
No, because there's someone also lying in front of a chest of drawers.
Yeah.
Of a chest of drawers, and this is in the Facebook. This is in a Facebook post that I saw. But anyway, Kobe, tell us, how is it like working in conditions like this?
I mean, one of the basic things in providing health care, I mean, or in emergency, is the fact that you must not do harm.
First, do no harm.
Yes, you must not do harm to the patient whilst providing the care. Unfortunately, we are not doing harm just to the patient, but we've extended it to relatives, and we are doing same to the healthcare, the limited health professionals. Now, bear in mind that when you go to the hospital, every nurse you see has a specialty area that they must perform, or they've been trained to perform. And when you go to the emergency ward, there must be emergency nurses. I don't know about the actual numbers, but as of last night, there was a single emergency nurse, I mean, who was supposed to be responding, looking at the numbers that were there.
To take care of all these people?
Yes, so they're a trained emergency nurse. So when you look at it, there's harm being done to the patient whilst nursing them on the floor, because you're likely to risk their to put them in an extra injury. You see some of them with cylinders right by them, which means that the cylinder could push over or it could fall anytime. And that could be much more disaster. You see the stands all by the corridor and all that, the patient could actually fall and injure him or herself. Now the relatives who come in and interacting, they are holding the patient, could also pick infections and go home with it and not spread it just within them alone, but they could spread in the community that they are. The spaces are limited. So if in case a patient has problem with the chest that is coughing and it's infectious, it could be transferred easily to the next patient. Now when you come to the health professionals who are supposed to have been handling a number of patients at a time, now are handling more in a very unfavorable positions. So you have to bend more, you have to squat more, you have to sit on the floor, you have to do all manner of things just to respond to this patient. And we shouldn't forget that very soon most of these professionals are going to break down health-wise, and they might be turning in their excuse duty, and who will be there to manage this patient? So that is exactly what is happening. I mean, so a lot of things are limited.
And as soon as listeners just go on our Facebook page, Joy 99.7 FM, you can see these pictures and you really understand what we are talking about. But we are here with Kobe Blay. Kobe is a nurse and he's also the editor of GhanaHealthNest.com.
Yes.
And he came across the situation of patients at the Korle Bu Teaching Hospital, Surgical, Medical and Emergency Center, sitting on the floor, lying on the floor, sitting on plastic chairs, sitting outside, sitting on the car park, receiving emergency care. And emergency care is the most critical kind of health care needed at times. And so we are talking about exactly some of the observations that he made. We will also be live at the Korle Bu Teaching Hospital ourselves this morning. We'll be speaking with Maxwell Agbagba live there to see what the situation is this morning. And then we'll go forward. Remember, we'll also go to the Komfo Teaching Hospital in Kumasi, where our listeners from Love 99.5 FM can hear Erastus Asaridonko also telling that story as well. I want to take these important messages and then we would come back and continue, because you see, last time we went, we've done a trip like this before, Papayo and myself. Papayo is our lead producer, and we spoke to the PRO of the Korle Bu Teaching Hospital. He told us that as of May, they are going to open the 70-bed accident and emergency center in Korle Bu. Has that one been open? No.
Well, it has not been open, and let me give you a little picture into this. Now, that new emergency place that is being put up may even not be enough, because the idea is to put everything together, to put all the cases together. Now, we have about 3, 4, 5 emergency units, from the gynae to the children and all that. SME alone, now when you even look at the numbers that are being taken, SME alone is already hitting about 70 at a go in a day. So if we are going to put all of them together, SME is coming, accident center is also coming in with all their numbers. It may not be enough, and there are certain structures still not in place at the facility. So
well, the PRO for the Korle Bu Teaching Hospital will be joining us for us to try and understand these issues a bit further. But let's take these important messages. This is Joy 99.7 FM, the Super Morning Show to be precise. Stay with us.
Welcome to 21st Century Service Provision.
I'm account
to pay one school fees.
What's the ratio?
Want to flex